Give it a couple more seconds here, but I'm going to be talking about the rather unsexy truth about the sex life for men after radical prostatectomy. So having the prostate removed, having a prostate surgery for the purposes of cancer treatment, right? So we'll be talking about that briefly because the truth isn't necessarily given to most men, and that's actually what the research has shown. In one research study, they actually found that over 90% of couples were misled into believing that their sex life would be just as good after the surgery, after prostate cancer treatment, as it was before. And that was misleading, 90% believing that, but in the actuality, only roughly 16% of men. 16% of men will actually be able to have an erection the same as they did prior to this surgery. Now you want to pay attention till the very end because I'm going to give you some information from some of the what should be considered top medical physicians in the United States, top experts in the United States when it comes to evaluating the benefit of prostate cancer surgery or even testing. So we'll be talking about that. And the reason I'm doing this is because I'm going to be doing a video tomorrow. And if you're viewing this on YouTube after the fact, you can go to my website, thewilddoc.com, and you can watch the entire episode, the entire video and live presentation I will be doing again tomorrow. I'm hoping people will tune in tomorrow if they have a father, grandfather, or you are the father, you are the grandfather, you are the husband who wants to go about the treatment of prostate cancer the most effective way possible. And yes, we're going to be discussing the most effective ways in which you can actually treat prostate cancer that has been shown in human clinical trials. Yes, men put to the test and having treatment put on their dinner table, that is more effective than any current medical intervention. And that includes chemo, radiation, and surgery, and in fact, the drugs they use to lower your testosterone to supposedly prevent the progression of prostate cancer. Which the side effects of the medication are much similar to the side effects you'll be learning about here. But maybe this was just an extra push I had. I figured if I'm going through all the notes and going through the side effects of these treatments, I figure if I encourage men in a way that many men will actually listen. Ladies, you probably know this firsthand. If you're married and your husband, and if you want them to listen to you, sometimes just mentioning the word sex, and all of a sudden their ears perk up and they'll turn from their cell phone or their TV or the football game and listen to you. So sex sells, and maybe sex will actually motivate men to do what is the most effective manner. But I will tell you, in the clinical trials, they have found that, and this is something I'll be discussing more in depth tomorrow, only about 3/4 of men were willing to make the dietary and lifestyle changes that are effective, and again, I'm going to say this again, more effective than the current medical treatments that your doctor could ever offer you. Only 3/4, which is the majority, but sadly I don't understand the rest of the men wanting to eat pork and cheeseburgers and stuff like that. I'd rather be having sex with my wife than eating a pork chop. I don't know about all you, but that's just me. So again, the studies have concluded and shown that only 16% of men will be able to go back to their erectile function, their ability to get an erection, to have sex effectively. And it's even worse for men over the age of 60. Men over the age of 60, only 4% would be able to recover their pre-treatment. And this is treatment. This isn't the cancer causing the erectile dysfunction. This is the treatment causing. So that would be the surgery, and surgery specifically here in this discussion. But radiation can have much the same effect, as it will deaden and damage nerve endings that control the vascularity. That would be the blood flow to the penis. So I don't know why I thought about the Varsity Blues movie there. Penis, penis, penis. I don't know if anybody else gets movie quotes like I do, but that's me. So I made myself laugh. Anyway, studies generally consider, and what is the problem? Why would men, so going back here real quick, why would couples, not just men, surgeons led 90%. That would be the medical physicians performing the surgery. 90% of couples were misled into believing that they would be able to go back to their sex life just as they did before. So why are they being misled? How are they being misled? Well, the reality is many of the surgeons probably don't realize the truth either, because oftentimes conventional medical literature will say 60 to 70% of men will achieve erection again after surgery. But again, they might achieve it, but doesn't mean they're going to achieve it as well and as often as they would like. And that's what when looking at true capability of sexual function after surgery, after a prostatectomy, having your prostate removed, the surgery left the majority of men, well, they said, here's how we say 60% to 70% of men are able to return to normal sex life. We just considered it normal if the man was able to have an erection 50% roughly. Close to 50% of the time, he was able to get an erection good enough for penetration. That's not actually strong like bull, as I'd like to say. That's just able to get it in there. Yeah. So as long as you're able to get it in there, they said, well, 60 to 70% of men are able to at least get it in. That's not good enough for me, I would say. And that's why I would actually decide I would probably go with the natural treatments that are clinically shown. That means they're human trials. And again, we'll be discussing this in the video in the live broadcast tomorrow. So, prostate cancer survivorships, a review of erectile dysfunction and penile rehabilitation in prostate cancer. Again, the contemporary literature said that it's 60 to 70%, but again, that's if you're measuring your ability to just get somewhat of an erection to penetrate. That's it. Another common complaint, though, men who have undergone prostate cancer, it doesn't just end with the inability to get it up. It actually means to get it out there or get it in there. Contemporary literature reports that approximately 2 to 3 centimeters of stretch or length in the penis is lost after the surgery. And also, the men's length is often accompanied by other penile deformities. So, direction it hangs, I guess, and things like that. Prevalence and predicting factors. And guys, this is the peer-reviewed medical literature out there. I just think that most men should be given the truth. And I'm being a little sarcastic. But my heart does break, and, you know, I feel bad for the couples that have been misled. Again, 90%, if you go back to the beginning of this video and you're just tuning in, 90% of couples were misled by their medical physicians, their surgeons, into believing they would be able to have a normal sex life just like before that surgery. And I bet if we pulled all those same men who were told you'll be able to have sex just the same after the surgery as before, I bet you the majority of them weren't told by their medical physicians that this surgery isn't more effective than doing nothing. Now, if your prostate is so swollen you can't urinate, you could say there's a time for a skilled surgeon, all right? This isn't 100%, but I am going to kind of stick my neck out there and say, you know what? I bet it's more than 90% of the time the surgery was unnecessary. Unnecessary in the way that it actually led to men living longer or being needed to fix an actual issue that surgery was absolutely critical in relieving and fixing. So I would have to say, though, probably the surgery wouldn't be necessary even for men who couldn't urinate because of such a swollen prostate, because you could catheter and you could pee that way while you went through the natural interventions that have been shown again in human clinical trials to reverse, even metastasize. That's cancer spread to your bones. Again, this is stuff I'll be going through in the full-length video, and we're going to be live broadcasting tomorrow. If you're watching on YouTube or Facebook in the future and you missed the live broadcast, guess what? Just go to the website, thewilddoc.com, and get access to that full broadcast. And then to the peer-reviewed literature. If you're on Facebook right now, I believe Ashley, my loveliest assistant, you got the TWD working, right? So if you TWD in the comments right now on Facebook on this video, you get links to the link to the blog post on thewilddoc.com, which will lead you to be able to find each one of these peer-reviewed medical literature articles and studies to confirm for yourself the truth, the unsexy truth about prostate cancer treatment and surgery. So going back to my notes here, patients are also bothered by the number of lesser known sexual side effects. Some of those sexual side effects, not just the inability to get it up or get it in or the length loss, there's also altered perception of orgasm. So that would be unique. I'm not going to go any further into that, but orgasm-associated pain with orgasm. Penile sensory changes, numbness, tingling, no real sense of foreplay. Some other things here. UI, that would be urinary incontinence. They had to abbreviate that one for you folks. Urinary incontinence during foreplay. That means peeing, not being able to hold your bladder. Thus, a stimulation of foreplay and sexual stimulation caused the man to pee himself because of the surgery. Orgasm-associated incontinence. Incontinence would be pooping yourself. Penile shortening and penile deformity. Now, this should all be like, well, it may be like I've heard from a lot of couples that I've sat down with and discussed this topic with, that they'd rather, or since many of them already did, and then the cancer came back, which is sad in and of itself, but they say we'd rather him be alive and lose our sex life than him been dead and we've lost our sex life anyways. And that's a valid point there. It's a valid argument or a valid, concern, we should call it, when it's in the perspective of the patient. But the reality is, U.S. Preventive Service Task Force, as the Journal of American Medical Association viewpoint article quite simply points out to all of us, gives us all the ability to read, the U.S. Preventive Service Task Force redid its recommendations. In 2012, the U.S. Preventive Service Task Force actually assessed the benefit of prostate cancer screening men for prostate cancer with PSA blood tests, and they rated it a D. And mind you, their scale doesn't go to an F, so you don't fail, you fail with a D. So now they've changed it to a C, but a C is there's no confidence in it, basically. We have no confidence in the screening to actually do anything. But you know what? You can have a discussion with your provider, your medical physician who wants to screen you for prostate cancer, or the one, hopefully, that isn't recommending it, but saying if you want to do it, and we'll talk about it. A blood test could be harmless, yes. But it's what that blood test leads you to do. That can make all the difference. And the difference is what we're going to be talking about tomorrow night. But directly from this article, you'll read that the U.S. Preventive Service Task Force reviewed the evidence showing, this is the 2013 review, or 2017, I apologize, evidence showing that the effectiveness, or showing that the active surveillance may be as effective as surgery or radiation in preventing death from prostate cancer in selected men. Although additional studies with longer short-term follow-up are needed to evaluate for an increase in metastatic disease, which was observed in one trial. So an increase in metastatic disease. But you have to remember that going through the treatments, radiation and surgery, have actually been shown to increase overall mortality, men dying from stroke, from heart attack, from other types of radiation-induced side effects like perforations and holes being burnt into the intestines of the man, and the man dies of systemic infection, sepsis, as a side effect of the cancer treatment. So now he's no longer a cancer victim, he's sadly, feces got into his abdomen. Sepsis, infection. See, these treatments have a side effect of causing men to die earlier than just letting it go about its natural course. So yeah, there would be an increase in metastatic cancer because men were able to live long enough to allow the cancer to progress further rather than dying of heart attack, stroke, or blood clot while they're on the operating table, which is another side effect, not just the loss of your sex life. The side effects of the surgery could actually be death, and it is. So that being taken into account, I think it would be very frustrating for men to find this information out after the fact. This is why we have to start educating men on the reality of effective treatments that aren't found in their medical physician's office, but are rather found at their local grocery store for the most part. That's the beauty of focusing on the true underlying factors that lead into the development of cancer. We could discuss many other cancers for that matter, but prostate cancer, we have the clinical human trials showing effective treatments that are at your local grocery store or in your backyard. And we're going to be leading you in the direction to understand and know about those things tomorrow night. Again, we'll be going live 6 p.m. Central Standard Time. And again, learning that doing nothing, that's what active surveillance. See, they have a medical term for do nothing. It's called active surveillance. You stand by, you do nothing, and you just keep testing and looking at the man's PSA or their blood work or their scans. So what's the benefit there? See, if you've been to a doctor or you've been to an individual, you called your doctor and they didn't teach you anything, guess what? You never saw a real doctor. You need to be taught something. You need to learn something. That is the true definition of a doctor. And that's why we're teaching men how to effectively prevent prostate cancer or get to at least the root causes, remove those or reduce those so that their prostate cancer risk would be so small that really they need to go about life without worry about that cancer ever hitting them. And then they would be able to make the right decisions when given the proper amount of information that's there to every one of the doctors out there who are supposedly testing your PSA or treating your prostate cancer. They have access to every one of the medical journals that I'll be reviewing tomorrow. Everything will be backed by peer-reviewed scientific medical literature showing you that there are effective ways to go about not just doing nothing and actively surveillancing the situation, watching. You don't have to sit by and just hope that it doesn't get worse. You can actually do something about it. But you could do nothing, or you could do the surgery and the radiation, and either way, you're just as well off. And in fact, the literature shows you'll probably live longer if you just do nothing than doing the medical treatments. And that's sad. And that is why the U.S. Preventive Service Task Force still remains to give the PSA screening, prostate-specific cancer, screening tests, a C. That's no confidence. And again, their pass grade was a D in 2012. And I will be reviewing the fact that the regulatory board, the U.S. Preventive Service Task Force, has been captured by industry. That means the ones who are making money on prostate cancer screening and treatments have actually begun to corrupt this organization. But even with the corruption available to them and the money being, whatever, sadly, it's still a C. So let's make sure that we let people know. Share this video, like the video, heart the video, and I know the Facebook doesn't want us to say all that stuff, but if you heart your father or grandfather or your husband, make sure that they attend the workshop here in person in Clarksville, Tennessee, or if they're not in person available to be here, well, make sure that they watch it online, because again, the truth might not be sexy, but I think men would rather be having sex than believe in a lie. So I'm going to give them the truth. And so I want you to share the truth. Don't just like it. It's the only way we save lives, and in this instance, it's the only way that men will be able to retain their sex life. And the good thing about it is, guess what? The treatments I'll be talking about, the science I'll be talking about, actually enhances your sex life.